In today's video, I want to teach you about how movement can reduce pain. We're going to talk a little bit about the neurology around how that works and specifically how you can use movement to reduce pain. Hi, I'm Dr. Jesse Morris. I specialize in both functional medicine and chiropractic. As a chiropractor, pain is one of the main reasons why people come to see me. So let's talk a little bit about the neurology behind pain. So if you have an injury, right? Classic injury, you stepped on a nail. And listen, I know my drawings are amazing. If I choose a second career, it's definitely going to be art. So listen, if you step on a nail, there's going to be nerves that carry the information about that injury up to your brain. But those nerves aren't one continuous wire, right? You can think of it more like a relay race. There's going to be a set of nerves that are going to carry the information about that injury from your foot up to your spinal cord. And those nerves are going to pass the signal along to another set of nerves. They're going to carry it up the spinal cord to the brainstem, where they're going to pass it along to a third set of nerves. They're going to carry that signal up to your brain, where it's processed and where you actually get a conscious perception of the pain, right? Ouch, you just stepped on a nail. But one of the amazing things about your body is that it has these mechanisms built in to block the relay of those signals in the spinal cord, so the pain signal can kind of get dampened or blocked and not actually reach the brain and give you that perception. And movement is one of the main types of stimulus that can fire the nerves that block those signals from being transmitted up to your brain, okay? A great example of this is if you've ever smashed your thumb or smashed your finger with a hammer, right? The natural tendency or the natural response is to shake your hand, right? Ow! And what's happening is the signals from the movement of the muscles and the joints of your wrist and the elbow are going into the spinal cord and blocking or dampening the signal, the pain signal that's coming from the smashed thumb, right? It's brilliant. It's another reason, it's one of the reasons why chiropractic adjustments are helpful in reducing pain, right? Chiropractic adjustments improve and increase the amount of movement in the joints and the muscles of the spine, which can be, those signals from that movement can come into the spinal cord and block the signals, the pain signals coming from the body up to the brain, right? So if you have an injury or chronic pain, right? Say you have, knee pain or shoulder pain or neck or back pain, right? How do you use movement? How can you use movement to reduce that pain sensation? Well, obviously you can do exercises specifically to an area of injury, right? Say it's a shoulder injury, you can do shoulder exercises, knee injury, knee exercises. But there are times when there's an injury that's just too sensitive, right? It's too inflamed, it's too flared up, and movement actually exacerbates the pain. So in those situations, you have to use movement around the area of the injury and not specifically in the injured joint or muscle. An example of this is like, say I have a knee injury, right? And it's just too flared up, too inflamed, too tender to use specific knee exercises to try to rehab it. What I can do is use ankle exercises or ankle mobility or hip mobility, and the signals from the movement of the ankle or movement of the hip are going to go into a similar area of the spinal cord where the pain signals from the knee are coming in, and are going to block it at that level and reduce the signals that are getting through from the knee up to the brain, right? So interestingly enough, movement's really helpful, but also there are certain types of touch that can fire a similar pathway of blocking pain. So light touch on the skin, massage, or vibration, right? Something like a massage gun specifically around the area of where an injury is can be helpful also to add that stimulus in that can block the pain sensations from being relayed from the body and getting up to the brain. So listen, if you're working with an injury, you have chronic pain, I really encourage you to keep your body moving, right? Exercise in general can reduce endorphins or produce endorphins that can block pain signals. And then there's the specific aspect of movement, signals up from movement in the body getting into the spinal cord and blocking those pain sensations. So you're gonna have to experiment a little bit, right? You have to experiment with what exercises, what types of touch or stimulation can be helpful for you in blocking those sensations. So I encourage you to do that experimentation. It's really worth it to be able to use movement and naturally reduce pain, because chronic pain's no fun, right? It really sucks. And so using movement can be a powerful way to reduce it. So listen, I hope this is helpful. I hope this is inspiring to you. And thanks for watching. I look forward to seeing you soon.